The top 5% of the patients in any given area across the province utilize about 2/3 of the resources. We were provided a unique opportunity through the Ministry of Health Priorities to transform not only the understanding of these clients, but to act in such a way that would provide better patient outcomes. So our approach in year one was really to accomplish the following. We wanted to establish deep relationships with our community providers as well as with primary care. We want to develop coordinated care plans for all of our HealthLink clients, regular and timely access to their primary care provider. We wanted to make sure that we engage our First Nations community, reduce the ER visits, reduce the inpatient stays, reduce the length of stay or the average length of stay for our clients. We really wanted to understand the social determinants of health for these high users of the healthcare system, and to understand the impact that the lack of transportation has on our clients. Our steering committee has provided tremendous leadership on how to attain these goals, and I can't emphasize enough the impact that these leaders have had on our HealthLink process. We really want to take a step back and look at what was here locally. We had everyone from our steering committee talk about identification of gaps, and we spent a lot of time with our patients learning the gaps from their perspective, and also asking community service providers what gaps in care are currently out there. The Canadian Index of Wellbeing has started to give us a real picture of who these clients are. When you have conversations with these individuals and you really talk to them, what is most evident is that it's social determinants of health that have the biggest impact on their health and well-being.
For instance, we asked HealthLink's clients how they perceive their own physical and their own mental health. You can see from these charts that their own sense of their own physical and mental health is poorer than that of the national average. We also considered the prevalence of chronic diseases in our HealthLink's clients. Mental illness, heart disease, diabetes, and lung disease were the most prevalent chronic conditions. 85% of our clients have 3 or more of these chronic conditions. Many of our HealthLink patients live in isolation. This often means they have no contact with family and friends anymore. And we know from considerable research that people who live in isolation have much poorer health outcomes because those supports aren't there anymore.
74% of our clients live below the poverty line, and obviously that has a dramatic impact on other areas of their lives. We learned early on that a lack of transportation had a huge impact on the majority of our clients and their ability to access healthcare.
Getting to places, it's really hard here in Midland. You just can't go and hop on a bus. It's only like once an hour. And then you gotta wait an hour, and then it's gonna take you another, 45 minutes just to get there. In that time, something could go wrong. A lot of people, they don't go to the hospital, they don't go to the doctors because they have no way. And it's so hard, especially when you're on a low income.
You can have the best care in the world from your primary care physician, but if you can't get to appointments and you have no food in your fridge and you're socially isolated and that affects your mental health, all of those things are critical.
These are all pieces that all contribute to those individuals being high users of the system.
They started with 3 physicians and then had 3 physicians ask 3 more to come on board and identify patients. And to me, it's an innovative and interesting way to involve primary care.
So when I initially meet my client, I ask them to review a map with all the social determinants of health, and I work with them to develop goals that they would like to work on. So obviously physical health and mental health are included, but they also include other determinants such as the transportation, housing.
When you start to form a relationship with clients and you have open conversations, you start to hear the true needs that they have, and now you're working as a team.
We've been able to connect some First Nation, Métis, Inuit clients, and the response from them is that they've never felt so cared for and understood and helped in their whole journey of healthcare.
I trust the people that I've met in this office, and for me that is huge.
The next step is to have a case conference. So we have over 25 providers in this area that at any given time will get together in kind of a teleconference format, and the care coordination begins from there.
We identify the client's goals, who will assist with achieving that client goal. We actually have a plan of care developed, and then we share the care plan with everybody involved in the client's care.
We decided we were approached to be involved with the care coordination tool, which is basically taking your care coordination plan and housing it electronically and allowing providers to be able to access that information.
I help the client identify their goal in achieving overall health, and I help them connect with the service that will achieve that goal.
I have access to so many agencies and that I didn't know were available. This is a definite necessity in the community.
HealthLink is really bringing organizations from acute care, community, and primary care together, and we're working under one goal.
A great example of that is our monthly meetings with GBGH, with our high user discussion group, that has really allowed us to work very closely together to find the best ways to serve these clients.
I've actually had the time to sit with my clients and build that trusting relationship where then they reveal information such as, I don't have food in the home, so some clients I've gone to Salvation Army and gotten them food. Other people will reveal family issues, relationship issues that they're having, so then I've helped with that.
But we committed to with our first clients to make sure that go the extra mile, because if we're not doing that work, who is? And the answer is there isn't something out there for a lot of these clients, and we've taken that on as part of our HealthLink process.
So HealthLinks is intended to really work with those individuals very closely and very intimately and rebuild a circle of supports and care for them and around them to help them have a better and more fulfilling lives.
Hearing the impact on these patients, seeing them talk about hope, being connected, having somebody and a team that cares, is really what HealthLink is all about.
I like to go on skidooing and ice fishing and things a normal man does, but I can't walk out there anymore. I never knew before when losing one leg would cause so much pain and disabled to do so many different things. I've had a massive heart attack, died on the table, was brought back. I don't know why, but they did it. When I got released from the hospital, there used to be a couple of nurses that would come to the house. Tracy stopped in and she asked me if I was interested in joining in here. Well, I was really concerned about being able to find a doctor that was accepting patients.
Michael came to us kind of down, not doing great. He really didn't have a long-term plan for his health. HealthLink's representative, Tracy, came by, had a talk with me and said that she'd think someone would be a really good fit for our clinic here, really to better meet his needs from a cultural perspective, from a health perspective, from a service needs perspective. And then I met him and we've been working with him ever since, the last few months. But he's made a lot of changes.
Since I've joined HealthLink, I've come up and I work with Renee. She's my therapist. Because I'm stuck in that thing all the time, my muscles shrink up. I come here to get my blood work done, and joined the quit smoking program. Tracy has assisted me in transportation. Financially, like I'm only on a pension, I don't know if I'd be able to pay my rent, feed myself, and be able to afford the transportation back and forth. I'd have to try and hitchhike or something. like in a wheelchair, you're not going to get many rides. I wouldn't be able to make it here to get to see the doctor or to get blood work done or to see the therapist, to meet my goal and be able to walk by myself. And I wouldn't be able to accomplish quitting smoking. The Health Link, that's what's really helped me out 100%. I think this is the best thing that's ever happened to me.
So Michael really has a new team that he relies on for his health care, and it's impacted his care and his quality of life tremendously. We're able to look at the number of times that Michael visited emergency the 12 months pre-HealthLink, and then his emergency visits since he's joined the HealthLinks. And we know that he now has no visits in the 8 months that he's been engaged with his new healthcare team. We also have the ability to analyze the broader picture and understand that as a collective, our first cohort, we've had a dramatic impact. 57% is the reduction in their ER visits, a 68% reduction in the inpatient stays, and a 42% reduction in their length of stay. So the data really allows us to understand the impact of the interventions, but also allows for better planning and ultimately a better patient experience. So we're very proud of a very busy and very productive last year. First and foremost, I really believe it's the relationships that we've developed in the community and the leadership of our steering committee partners that have allowed us to get to the point that we're at today. We've been able to complete the 60+ care coordination plans that was mandated by the ministry. We have timely access to primary care. Through our partnership with our Aboriginal Navigator, 20% of our clients are First Nation Métis Inuit. We've had a significant impact on ER visits, inpatient stays, a reduction in their length of stay, and we now have national interest in our work with the Canadian Index of Wellbeing and the social determinants of health, along with our Transport Health Survey. We have heard from the patients in our community and listened to their thoughts and followed through on their goals. And as we look to year 2, we want to build on these successes and continue to learn what is possible through the navigation process, patient stories, and working collaboratively to provide enhanced care for the clients that need it the most.